CAR T cells are not a standard of care for patients with CLL. They're not FDA approved, and they're really only used in the context as an experimental therapy. These are genetically engineered T cells which are directed specifically at this point in time against the cell surface marker CD19. There have been very small series which have demonstrated promising data and activity for these cells, largely at academic medical centers, with or without combination of molecules like ibrutinib. I think that CAR T may have a future in CLL in terms of being utilized, particularly where transplant had been previously thought of. I think it remains to be seen how these active cells will be brought into the overall sequencing strategy for patients with CLL, and whether or not they'll represent a paradigm shift, it still remains to be seen. Larger series, more data that's generalizable to practices, the ability to develop these cells and utilize them as more of an off-the-shelf type of product are all the things that we really need to see to help make these products more available for patients. With that being said, the general concept of utilizing the immune system, activating the immune system to kill cancer, I think is very impressive. The major competing factor in CLL is that we've had so many wonderful molecules that have been developed that are active, which have already been demonstrated to prolong survival. So it's a crowded space, and I think they'll fit in, but I'm not exactly sure at what line of therapy and for whom will be the best candidates at this time.